Hello, my name is Liliana Ansari, and I am the Community Programs Resource Advisor for the Tuberous Sclerosis Complex Alliance, as well as parent to a 12-year-old daughter with TSC. TSC 101 is a brief overview of TSC related to education. I encourage you to spend the remainder of your time together discussing the individual needs of your student, as well as question and answers with your presenter. The TSC Alliance is an internationally recognized nonprofit organization that works to improve the lives of people with TSC. We drive research, improve quality care and access, and advocate for all affected by the disease. We work to ensure school systems understand and adapt to the learning needs of students with TSC. Publications available to you in digital or print format are A Teacher's Guide to Educating a Child with TSC, Behavioral Issues in TSC, Transition from School to Community, and a healthcare packet for the school nurse. Our Educator Mentor program provides one-on-one support to any professional working in the education setting from pre-K to college, so they can recognize how TSC affects learning and to create greater educational experience for their students. We also provide expert guidance on developing IEPs and many other resources to help families navigate special education programs for their student. Tuberous sclerosis complex, or TSC, is a rare genetic disease that affects people at all stages of life. Every individual's experience with TSC is different. Many can live independently, while others may require complex care throughout their lives. TSC is caused by mutations in the TSC1 or TSC2 gene. Mutations in these genes lead to overactivation in what's called the mTOR signaling pathway. Overactivation in these pathways lead to loss of control over cell growth and cell division. This can cause the development of non-malignant tumors or tubers in all the major organs of the body. An estimated 40 to 50% of individuals with TSC have autism, making TSC a leading genetic cause of autism. Approximately 85% of individuals with TSC also have epilepsy, and 2/3 of them don't have full seizure control with the existing treatments. Tuberous sclerosis is a very different disorder than tuberculosis, though often mistaken for one another. TSC is often undiagnosed, but we do know that at least 2 babies born each day in the United States will have it, and nearly 1 million people worldwide and 50,000 people in the United States live with TSC. TSC causes tumors to grow in different organs and can impair each organ's function, primarily in the brain, eyes, kidneys, lungs, skin, heart, and even the gums and the teeth. Abnormalities in the brain caused by TSC have the biggest impact on quality of life and on development. Skin manifestations in TSC are hypopigmentations called ash leaf spots or chagrin patches, small fibrous growths around the fingernails, and facial angiofibromas. Some of these skin manifestations, especially in older children, can cause self-esteem issues, depression, or anxiety. Kidney tumors occur in about 70 to 80% of older children, and it can cause kidney disease. Heart tumors usually form in infants and are typically largest at birth. Often this is how a lot of our kids are diagnosed in utero. with the existence of these heart tumors called rhabdomyomas. These are the only tumors that typically shrink as kids get older, and some will have longer-term health problems that need to be addressed or monitored. But heart issues can interfere with PE classes. They can be dehydrated or overheated. It's important to pay attention to that. Lung manifestations are far more common in girls and typically occur in the older teen years. Some patients with lung involvement can develop LAM, or lymphangiomyomatosis. One of the first symptoms of LAM can be shortness of breath or coughing after exercise. When there's brain involvement, learning issues can develop. And even in the most mildly affected individuals with TSC, they can have learning issues that will impact their education. Again, 80 to 90% of individuals with TSC have epilepsy, and many children are diagnosed with TSC in infancy after they have a catastrophic form of seizure called the infantile spasms. Older children and adults can develop other types of seizures later, including generalized, complex partial, and other focal seizures. It's important to note that seizures in our kids can be very subtle, and seizure first aid and emergency seizure action plan should be in place and followed in the educational setting. Communicating with parents or caregivers about suspicious or seizure activity is typically a crucial part of managing care for the students. TSC-associated neuropsychiatric disorders, or TAND, is a word used as a tool for awareness around these issues. When there's brain involvement, there can be learning disabilities in kids with TSC, and students may need to have an update to their IEP more often, depending on seizure activity, tumor growth, or medication changes, or even brain surgery to address seizure activity. Behaviors and learning issues can be a red flag for tumor growth or increased seizure activity, or sometimes not visible, such as abnormal brain activities that can affect behavior and development in kids with TSC. ADHD is a common neurobehavioral disorder in children with TSC, and about 1/3 of kids will have evidence of it. Over the years, it's been recognized that between 1/4 to half of children with TSC have autism. The rate of autism in the general population, even though it's increased, it's still much lower. Individuals with TSC experience a higher rate of anxiety than others. Anxiety can manifest itself into forms of excessive worrying, sporadic behavior, and unexplained panic attacks. Some students who are more impacted by TSC can also have outbursts and behaviors such as self-injury or aggression towards others. Sometimes as students get older, the aggressive behaviors are reduced, but can be replaced with anxiety or depression or other mental health issues. Individuals with TSC often have depression, which can look very different in young children and can often be misdiagnosed. TSC experts also recommend a thorough neuropsychological evaluation in order to get the best data on identifying students' baseline and their needs. It's important to keep in mind that parents of a child with TSC are experts in their child's manifestations, the medications available to our kids, and in their child's TAND. And they're the most knowledgeable resource in educating a child with TSC. For further information, please refer to TSC101-2 or email me at lansari@tscalliance.org. Thank you.